Hi, everyone. I am Janessa Smith, the Executive Director for the Georgia Commission on Women. Thank you for joining our Wellness Summit this year. I'm super excited about this next discussion, a topic that has become near and dear to my heart. As a grandparent of a recently diagnosed grandson with autism, it's my pleasure to introduce Madeline Vickery and Savannah Yelkin from Already Autism Health.
Hi, I am Madeline Vickery. I am a BCBA and clinician at CABS and now partnered with Already Autism Help. We are located in Statesboro, Georgia, and I'm happy to be here today.
Thank you, Madeline.
Savannah. I'm a BCBA and clinical director at Commonwealth, now partnered with AAH in Fayetteville, Georgia, and I'm also really excited.
All right. So before we get started into the clinical side, I'd love for the audience to know who you are as people, what first drew each of you to this field, and what keeps you in it.
Well, I grew up analyzing everything around me and kind of always wanting to understand why people do what they do. And that natural curiosity kind of led me towards a field focused on behavior and learning. But I would say what initially drew me to ABA was having an incredible mentor who kind of showed me the meaningful impact we have on children and families through the application of behavior principles. What has kept me in the field is probably the challenge. Every child is unique, and there is always an opportunity to learn and problem solve and grow. The most rewarding part is really watching children come into services with very limited language, and seeing them develop communication skills and independence and that confidence over time. Seeing child's progress, to the point where they can successfully transition into a general education classroom or, the least restrictive setting is just incredibly rewarding.
Thank you. And do you, Savannah?
So I got in the field really in college. I knew I wanted to help people. I just didn't know the best way to do that. I discovered ABA, and I really liked that it was evidence based, and there were clear graphs to show that I was making a difference and I was helping. I've stayed in the field because I've really developed a passion for working with neurodivergent individuals and making a difference. And really, it's just the little moments every day, seeing someone overcome a challenge, parents feeling accepted and heard. Really, every day it's something new.
Thank you both. For the families in this room who may just be starting their journey, what's the one thing you wish someone had told them on day one?
That's a good question. Uh, for the families in the room just starting this journey, I would say that autism is a spectrum, and every child's path is going to look different. Try not to compare your child to another child on the spectrum. Progress, may not always happen as quickly as you'd like, but every step forward, really matters. Celebrate those small wins, ask questions, and ultimately trust the process.
Thank you. Anything you'd like to add to that, Savannah?
Yeah, so I think getting a diagnosis is very brave, and it's not always the most easy thing to even initiate that first step and accept that your child might be autistic. But knowing that I early support is very important, and it's going to make a big difference in the child's life. And really, it serves as a key to unlock very valuable resources.
Thank you, Savannah. Madeline, a question for you. As a BCBA and a licensed behavior analyst, your training is deeply clinical, but the families you serve are walking in with emotions, exhaustion, and sometimes guilt. How do you balance the science of what you do with the humanity of who you serve?
Well, before I even introduce the science of ABA to a family, I'm a listener first. So, my first responsibility is to hear their story, their experience, their everyday challenges, their successes, and their concerns. Those conversations are what guide the intervention. ABA should never be about imposing goals on a family. It should be about identifying what is socially significant and meaningful to them. What are their priorities? What would make the biggest difference in their daily lives? And what do they hope? What are their goals for their child? And once we understand those things, we can use the science of behavior to help guide them to get there. The family's voice should always be the center of the process because they are the experts on their child, and they're the ones who are going to be the most impacted by those outcomes. Um, I believe that humility is essential in this work because, before I'm an analyst, I have to be a listener. As a clinician, I may have expertise in behavior analysis, but families are the experts on their child. Um, so yeah.
Thank you. Savannah, for the parents and grandparents in the room who are new to this conversation, in plain language, what is applied behavior analysis and what is it not?
That's a great question. ABA is an evidence-based therapy that's very good at finding meaningful and effective replacement behaviors for things that might be more destructive, like if a child might hurt themselves, hurt other people, run away, um, and then teaching adaptive skills to really match them to same age, typically developing peers. Um, it's always about increasing their quality of life, not just making other people in the room comfortable. So we always have to be really intentional with the goals. ABA is not a cure for autism. It's not meant to get rid of perfectly harmless autistic traits. It's meant to really let the client find themselves and be the best version of themselves.
Okay. There's a lot of conversation right now, including a recent Bloomberg's Business Week feature about whether ABA is the right approach. How do you talk to families who come in skeptical or who've read online criticism?
That is so tough because every time I see a family that's more anxious and has done their research, I really see that the anxiety is rooted in care and compassion for their child. So I don't think that's right to dismiss that. Unfortunately, there's some outdated practices that have caused real harm. And there's a very large push in our field to focus on assent based therapy, trauma informed, and make sure that we're truly empowering our clients. I think it's important to do your research when you're choosing a provider to make sure that you feel comfortable, that they're targeting the right goals, they're involving families in treatment, and really just be an advocate throughout that process.
Thank you, Savannah. Madeline, ABA has changed significantly over the past 2 decades. What does modern, ethical, individualized ABA actually look like inside a session at Already Autism Health?
ABA has changed significantly over the past 2 decades, and I think it's a positive thing. Modern ABA is more collaborative, it's individualized, and it's focused on the quality. An effective session actually begins before the child ever walks into the therapy room. It starts at intake. So before we even talk about programs, goals, or interventions, we spend time listening to the family and actually directly observing the client. From there, we are able to develop goals that are individualized to the learner and aligned with the family's priorities. We really use the natural learning opportunities to incorporate teaching into the child's everyday life because skills are most meaningful when they can be used across all environments. So we focus on building motivation and engagement first, ensuring that we have that learner's buy-in for positive learning experiences. At the end of the day, we are working ourselves out of a job. Our goal is to set children up for success by building the skills they need to thrive in their next environment. Success isn't measured by how long a child stays in therapy. It's really measured by how independently and confidently they can navigate the world around them.
Thank you for that. Next question is for the both of you. Every child on the spectrum is different. How do you build a therapy plan that honors who that child already is rather than trying to make them fit into a single mold?
Hmm. I would say one of the misconceptions about ABA is that you complete an assessment and you pull goals from a checklist and every child gets the same program. That's not what we do. Assessments are definitely important because they help us understand a child's strengths or needs or communication styles. But the assessment is just the starting point. The real work is getting to know the child and the family. We spend time understanding what matters most to them, what challenges they're experiencing, what success in their everyday life, looks like. Two children may have the same diagnosis, but they have completely different goals. One child may need support with communication, while the other, needs support navigating socially. We don't believe in cookie cutter programs. We believe in meeting each child where they are and honoring, who they already are and building on their unique strengths.
Yeah, I think
You
that
know,
was wonderfully, sorry. I think that was wonderfully put. I also think we should operate a very like the same way. I ask myself a million questions whenever I'm assessing a child. Is this necessary for the child? Does this incorporate their interests? Will this benefit them? How is this going to translate to their everyday life? Um, and again, we don't want programs to be cookie cutter because that's not helpful. We have to think about how things are actually going to translate in their day-to-day life and why we're doing things.
thank you. Savannah, parents often hear about early intervention. Why does timing matter? And what should a family do if they're worried but haven't pursued a diagnosis?
Okay, that's a really good question. Um, again, I think getting a diagnosis is brave. I think it's something very easy to procrastinate and delay because um, accepting the diagnosis is very difficult. And I mean, it really means that your whole life could change. So that's understandable. But the early intervention window is so important to start working on those skills when a child is young. And I, it's not helpful to do things alone. You need a team, you need a village to make sure that you're not you're not doing everything by yourself.
Thank you. Next question is for the both of you. An autism diagnosis affects the whole family, not just the child. What do you see in the parents, the siblings, and the grandparents? And how do you support the people around the child?
Be good.
I think it's very important to involve the whole family. Of course, we don't want just one person. Of course, in our presentation, we were highlighting how mothers take on so much of the load. So it's really important to work as a team. Um, I mean, autism can affect people differently. I think families have to adapt, become more flexible, adapt in their routines, make sure to be very intentional to provide extra attention to siblings. Um,
Yeah, to piggyback off of that, I would say that we do that by listening first and understanding, the family's goals and challenges. We provide education and coaching, and, we need to create strategies that fit into their daily lives that's realistic for, the family and what they're actually dealing with day in and day out.
Thank you. Madeline, grandparents are often the unsung heroes, the second set of hands, the emotional anchor, and sometimes, quite honestly, the primary caregiver. What role do you see grandparents playing in a child's progress, and how can they be best equipped?
If you are someone who plays a meaningful role in that child's life, then you are a stakeholder in their success. And it's important that you're part of the treatment team. Our job is to partner with the people who know the child best. Not only know them best, but we have to equip them with the tools and ensure that they feel confident in supporting progress outside of therapy. How do we equip them? Well, by building and including them. We invite them to the conversation. We listen to their perspectives. We teach them practical strategies they can use in everyday moments to help them understand how they can better support and guide uh, this process. We, when people feel informed and empowered, they're able to make an even greater impact on the child's success.
Agreed. What's a small but practical thing a grandparent could start doing this week to support their grandchild?
I would say one small thing could be just start by spending 10 minutes a day following their grandchild's lead. Join them in an activity that they enjoy. Talk about what they're doing. Celebrate their communication attempts. Focus on the connection rather than the correction. Those small positive interactions really build trust and strengthen the relationship, but it also creates natural learning opportunities.
I like that. I'm going to take that away with me. Focus on the connection and not the correction. Thank you so much for that. Savannah, what are some of the misconceptions about autism that you find yourself gently correcting most often, whether from family members, teachers, or even strangers in a grocery store?
Okay, so I frequently hear people say everyone's a little bit autistic. When that I know it comes from a place of care and empathy, but at the same time, it's similar to saying everyone's a little bit pregnant just because you have swollen ankles. Um, it's a bit minimizing and not helpful. Even if it comes from a good place, even if we all can share some of the traits, um, to a lower degree. Maybe we can feel socially awkward. Maybe we can want our alone time. Maybe we have certain routines that we like. Um, Another misconception is autism needs to be cured or eliminated. And of course, there's challenges that come with autism. I've seen clients who engage in very harmful self injury, aggression, elopement that very much need support. I've seen skill deficits like lack of toilet training, difficulty communicating their wants and needs. And it's important to balance improving the child's quality of life while not erasing who they are. There's not really a need to focus on um, masking, like eye contact, or engaging with peers that they're not interested in. We want to make sure that we honor each autistic individual without trying to erase who they are.
And
Thank
if I
you.
can kind of piggyback off of that,
Absolutely.
one of the misconceptions I find myself correcting is that a child is being bad or that a parent simply, isn't disciplining enough. In reality, behavior is communication, and what may look like defiance or misbehavior to someone on the outside is often a child communicating a need or struggling to navigate their environment. So you have, one end of the spectrum and the other. Sometimes it's everyone has autism, and then, you have some where no one, it's just, I messed up there, but you got the
You're
part.
Thank you for adding that. I think that's very important what both of you just highlighted because early on when my grandson before his diagnosis, he didn't have the words. So a lot of times people thought he was just acting out. But since we have been educated and are finding or being given tools, we now know how to navigate it as he gets older. He can communicate and we can recognize okay, we need to try a different method to reach him when he's at this level or the next. So thank you both for that. I do have a question without you all breaking confidentiality. Tell us about a moment that reminded you why this work matters, a breakthrough, a first word, a hug that didn't used to happen.
That's so
I
challenging to pick. Um, Sorry, Madeline.
know.
But yeah, that's so challenging to pick because I feel like there's little moments every day. I've had clients say I love you to their parents for the first time, which is absolutely beautiful. Even children urinating on the toilet for the first time and throwing a potty party. Most more recently, I had a client who I had a difficult time trying to decrease his challenging behaviors. but we got to a point where I told him, "Can you believe you've met all your therapy goals?" And he started pretending to glitch of happiness because he felt proud. And I think anytime kids feel proud of themselves, or I guess like recognize their own strength, that's the most beautiful part of my job.
Yeah.
Thank you. Madeline?
I to kind of piggyback off of that, I would say I'm reminded, every day why this work matters. It's not one big moment, it's all of the small wins. Watching clients come in with high rates of maladaptive behavior, aggression, property destruction, in the hundreds, to decreasing it to zero rates and, transitioning back to the general education classroom. Those everyday victories are what keeps me passionate about this field and encourages the team day in and day out.
Thank you both. Madeline, already Autism Health operates across multiple states, including several locations here in Georgia. What does access to quality ABA look like in our state right now? And where are the gaps?
While Georgia has made great strides in increasing access to ABA, I would say one of the biggest gaps remains insurance. Families often face challenges with approvals, authorizations, and coverage requirements that can ultimately delay or interrupt services. I think we need a system where families can spend less time fighting for access and more time focusing on their child's progress.
Agreed. Savannah, earlier you mentioned that mothers carry a disproportionate share of caregiving when a child has a disability. What support systems do you see working well for moms, and where do we still have work to do?
Okay. So of course, in addition to providers who listen and involve moms in care, I think support groups are really important because there's just nothing that compares to having a group of individuals who can really understand what you're going through. Sometimes just as an ear to listen, sometimes to offer advice. I think that is extremely valuable. Help with respite care and childcare in general, so parents can focus on self care because that is something I see it so much. I think I recently had a conversation with a mom, and I was telling her, hey, make sure to take care of yourself. There's only one of you, and she said, I can't. I can only prioritize my family, and that is so important. So mental health services are also a big one to really make sure that mothers pour into themselves, and then I think we still have a lot of work to do because some of these systems, it's very challenging to figure out how to get the support and how to navigate services, just balancing everything. There's so much to think of in caring for an autistic child. Um, and and then in addition, I think workplace flexibility and just in general more empathy.
Thank you. The next question is for the both of you. Insurance, wait lists, Medicaid coverage, transportation. There are so many barriers between a family suspecting something and a child receiving care. If you could change one thing about how the system works today, what would it be?
If I could change one thing, it would be making access to care less dependent on insurance barriers. Families are often ready to get the help, providers are ready to deliver the services, and we know what supports are needed. But the process of obtaining and maintaining authorization can create unnecessary delays. I would love to see a system where families can spend less time navigating the paperwork and more time focusing on their child. These roadblocks, removing those roadblocks between a family and recognizing a need and a child receiving the services is really detrimental. Families shouldn't have to fight so hard to access this care.
Thank you. Following up on your last statement, there's an increasing public conversation about the cost of ABA and how those dollars are spent. From your vantage point, what does responsible, high quality care look like? And what should families be asking when they're evaluating a provider?
Great question. I think it's super important to understand that ABA is not a one-time medical procedure, like a surgery where a patient comes in, receives treatment, and leaves. ABA is a medical model that often involves months of assessment, treatment, monitoring, caregiver training, and ongoing adjustments, based on the child's progress. The cost of ABA supports an entire continuum of care. It includes direct treatment, BCBA supervision, treatment planning, data analysis, staff training. The list goes on and on. When families are evaluating providers, I would encourage them to look beyond the number of therapy hours and ask about the quality. How involved is the clinical team? How is progress measured? How are caregivers included? And how is the provider preparing my child to become more independent over time?
Thank you. Savannah, where do you see the field of autism care headed in the next 5 to 10 years? What's exciting you and what's concerning you?
So I'm hoping we continue to push to listen more to autistic voices and increase individualization and therapy goals. And then I'm also really excited about growing incorporation of different approaches like acceptance and commitment training, which focuses more on private events, like managing difficult thoughts and feelings, and identifying important values as motivators, because I think that really expands what we're able to do as a field. So focusing on psychological flexibility, self acceptance, emotional awareness, helping people build meaningful lives instead of the old focus on compliance. And then I'm really encouraged by increased collaboration with different disciplines in the field. Um, and then what concerns me the most is still access to care, because as you saw from our presentation, autism is only increasing in prevalence, or we're doing a better job in diagnosing it. And there's still a huge gap in providers available to match the need.
Thank you. Next question is for the both of you. For the educators, employers, faith leaders, and neighbors in this room, people who aren't clinicians but who interact with autistic children and adults every day, what's one thing you'd ask them to do differently?
I would ask people to recognize competence. Too often, we make assumptions based on how someone communicates, behaves, or even interacts with the world. Instead, assume they have strengths, abilities, and something valuable to contribute. When we focus on potential rather than the limitations, we are ultimately creating more opportunities for the autistic individuals to learn, connect, thrive, and just benefit from the world around them.
That is so funny because I was going to say the same thing, assume competence. But also, I think in general, just being curious before being judgmental, and also not assuming that communication deficits reflect a lack of intelligence. Many autistic individuals are still very capable, creative, have a lot of very unique strengths to offer. And then, in addition, I think us being flexible with accommodations, because often accommodations that help autistic individuals help everyone. So it's nice to have clear expectations, flexibility, patience, understanding, really to just make the world better.
Thank you. Last question for the both of you. If every person in this room walked out remembering one thing you said today, what would you want it to be?
I would say that a diagnosis is not a negative thing, and it does not change who a child is. And then our goal in ABA therapy is not to erase differences, it's to really empower the client and make sure they have the best quality of life possible.
Yeah, for sure. If there's one thing I'd want people to remember, it's definitely that our goal is to work ourselves out of a job. Success isn't measured by how long someone receives services. It's measured by increasing independence and improving the quality of life. ABA is a medical treatment, but at its core, it's about helping people build the skills they need to thrive long after we're gone. If there's one thing I'd want people to remember, it's that our goal is to work ourselves out of a job. Success isn't measured by how long someone receives services. It's measured by increasing independence and improving the overall quality of life. ABA is a medical treatment, but at its core, it's about helping people build the skills they need to thrive long after we're gone. That's why access to care really matters, and families should be focused on supporting their child, not fighting barriers to medical necessity. At the end of the day, behind every diagnosis is a person with strengths, potential, and a future. If we continue to focus on meaningful outcomes and support families and create access to high quality care, we can help more individuals reach their potential. Um,
Thank you. Well, as a grandmother with a recently diagnosed grandson, I want to thank you both from Already Autism Health for being a part of this year's Wellness Summit. I'm excited about this information, and if people wanted to follow up with you, how can they reach you?
you can reach me by email at madeline.vickery@cabs, C-A-B-S, autism.com, or by online, maybe.
Okay. And Savannah?
My email is savannah.yelkin@alreadyautismhealth.com.
Again, on behalf of the Georgia Commission on Women, thank you so much for being a part of this year's Georgia Wellness Summit.